Hello everyone. Everyone is present in the class. No? Pragati, Bushra, Ishu.
Good afternoon, sir.
Good afternoon. Good afternoon. So today's topic is rehabilitation in spinal cord injuries. Right.
Okay, sir.
So basically, today is the word of new medical technologies, branches, and discoveries. So branch of physiotherapy is gaining demand and popularity, whether it is an injury or a disease. So the physiotherapist's role is to assist in recovery process of the patient, and he or she helps to relieve pain, use the affected limb, or in extreme cases even teach the activities of daily living. Right? So physiotherapist's role is very important in case of rehabilitation, especially in SCI, spinal cord injury patients. So physiotherapy is being applied in every medical branch like neurology, orthopedics, cardiothoracic, and even antenatal and postnatal care department. Right? So one of the most common area of application of physiotherapy is in traumatic conditions like spinal cord injuries. So if injury occurs to the spinal cord or vertebral column, there may be some motor impairment and sensory impairment. So physiotherapist makes the patient independent and helps to recover from his diseased condition. Right? So one of the fine example of Christopher Reeve, he is one of the most popular actors who has had a large number of viewers from all over the world. Hooked on to thrilling episodes of famous television serial that is Superman. You know
सर थोड़ा
Superman?
सर लेट से ज्वाइन किया है सर कौन सा चैप्टर पढ़ा रहे हैं
Chapter is spinal cord injury,
ओके सर
right? Rehabilitation in spinal cord injuries. So Christopher Reeve is an actor and he plays a role of Superman. So unfortunately, he met an accident and resulting in injury to the spinal column at the cervical region. So injury to the cervical spine, leaving him with paralysis of all the four limbs. Although today he is in the category of most disabled person. So when the injury occurs at the cervical region, that leads to quadriplegia or quadriparalysis. Right? So although today he is in the category of most disabled persons, yet he has faith and hope that with physiotherapy he will recover from his condition. Right? So physiotherapy plays a vital role in case of spinal cord injury rehabilitation. Right? So the undertaken chapter rehabilitation in spinal cord injuries deals with the most recent studies regarding the etiology, mechanism of injury, and the latest modes of diagnosis and treatment. So on the basis of etiology, spinal cord injuries can be grossly divided into two major categories, right? We can categorize spinal cord injuries in two major categories. One category is traumatic and the other one is non-traumatic, right? If the cause is trauma, that comes in traumatic category. If there is any pathology, that comes in non-traumatic. Now we first discuss traumatic injury. So traumas are the most frequent cause of injury to the spinal cord in the adult age group. So severe injury to the vertebral column can occur from any direction and results in dislocation or fracture of the vertebra, right? So as a result, the spinal cord may be compressed, thrust, or stressed within the spinal canal, leading to various neurological problems, right? So approximately 70% cases of spinal cord injuries are traumatic in origin. The main cause of condition is trauma. So most of the injuries to the spinal column do not affect the actual stability of the spinal cord, and thus spinal cord is protected, right? But forces of greater magnitude worsens the condition, right? So spinal cord is protected by the vertebrae, passes through the vertebral canal. So vertebra protects the spinal cord. So when the forces of greater magnitude, it worsens the condition, right? Sometimes small injuries causes severe damage when the spinal column is weakened due to any reason like osteoporosis and any neoplasm, right? If malignancy is there, that weakens the spinal column, or we can say vertebral column, right? If the patient is osteoporotic, that condition also weakens the vertebral column. So, small injuries can damage the spinal cord because of osteoporosis or neoplasm, right? So the most important cause of traumatic SCI is the road traffic accident. There are so many causes, but the most common is road traffic accident, right? So the victims of road traffic accidents are usually between 20 to 24 years of age. So other major cause of traumatic SCI is industrial accidents. So industrial accidents involve falling of heavy objects on the head or the spine and some other causes. So the most common causes are road traffic accidents and industrial accidents, right? The other forms of injuries to the spinal cord results from sports injuries, gunshot injuries, explosion, domestic accidents, riots, and aircraft accidents. So these are the traumatic conditions that can lead to spinal cord injury. common causes of spinal cord injury. But the most common cause is road traffic accident, right? So road traffic accidents, industrial accidents, sports injuries, gunshot injuries, riots, explosion, and domestic accidents. So these are the major causes of spinal cord injury. Clear? So in short, spinal cord injury, we say SCI. So SCI in sports mainly results due to mismatched age, physical size, old equipments, ineffective shock absorbent, etc. Right? So also a sport person don't give emphasis on warming up. Some sports in which SCI is most frequent are like diving in shallow water. If somebody dives in shallow water, that can lead to SCI, spinal cord injury, right? Gymnastics, football, gliding, skating. In all these conditions, the spinal cord may be damaged, right? So there is always risk of spinal cord injury in all these sports. So domestic accidents mainly causes SCI in old age group due to their falling in bathrooms, right? We have seen so many cases. So due to fall in bathroom, the spinal cord may be damaged. Clear? Next point is the open wounds are the other factors which results in SCI. And open wounds are mainly caused due to violence and condition becomes severe when it is associated with infection of the wound, right? So all these conditions comes in traumatic category. The major cause of spinal cord injury. Now we discuss non-traumatic condition or non-traumatic category. So the non-traumatic damage of spinal cord generally results from a disease or pathological conditions. So spinal cord may be affected by many diffused or localized lesions, which causes different degrees of neurological problems, right? So it is estimated that non-traumatic damage accounts for almost 30% cases of all SCI. In non-traumatic SCI, the neurological changes appearing in a patient either results due to direct pressure over the cord or due to impaired blood supply to the cord, right? So both these factors slows down the conduction of spinal cord. So there are so many conditions, there are so many factors, those comes in non-traumatic conditions. So the common non-traumatic conditions can be classified as vascular malfunctions, number one, Number two is developmental cause. Next one is inflammatory cause. All these are non-traumatic causes. Next one is neoplasm. Next one is demyelinating diseases. Next one is neurological diseases. Next is infections. And another one is postural causes. So all these are non-traumatic causes, right? Now we discuss vascular malfunctions first. So any damage or disease of the vessels supplying the spinal cord cause impaired blood supply to the spinal cord, and in turn will slow down the conduction from the spinal cord. Right? And it results in paralysis. Clear? And the paralysis depends on the site of lesion or site of injury, or we can say level of injury. So the common defects causing vascular malfunctions are arterial venous malformation, thrombosis, embolism, and hemorrhage. We all know about thrombosis, embolism, and hemorrhage. We all know. Thrombosis means formation of thrombus in the vessels, formation of clot in the vessels, that is thrombosis. And when this clot is dislodged from the arteries or veins and moves one place to another place, this is known as embolism. The hemorrhage, we all know, hemorrhage, rupture of vessels, right? So arterial venous malformations, in this, mainly the lower thoracic, lumbar, and sacral parts of the spinal cord are affected by necrosis. And there is thickening of both extramedullary and intramedullary vessels. Clear? Next condition is thrombosis and embolism. These may occlude anterior spinal or posterior spinal arteries, and of the two, anterior spinal artery is most commonly affected, which supplies to the 2/3 part of cross section of the cord. So arteries and veins, those supplies to the spinal cord, if they are blocked due to thrombosis and embolism, necrosis occurs in the spinal cord, right? So occlusion of the spinal artery can be seen as sudden pain in the back and neck, and later there is paralysis of bladder and bowel, along with spastic paraplegia of lower limbs, right? So paralysis is a main clinical feature of spinal cord injury. Depends on the lesion, right? either it is mild or moderate or severe type of injury. Next is occlusion of posterior spinal artery, rarely occurs. All these comes in vascular malfunctions, right? So impaired blood supply leads to a spinal cord injury, right? Next thing is developmental causes like spina bifida. A neural tube defect is one of the commonest congenital anomaly, right? So of its two types, spina bifida occulta and spina bifida cystica. So spina bifida cystica mainly presents with neurological deficit causing problems such as paraplegia, right? So there is maldevelopment of vertebrae. So paraplegia, bladder and bowel dysfunctions, and sensory impairment are the causes of, are the symptoms of spina bifida cystica, right? Next is inflammatory causes like inflammatory granulation tissues may spread in epidural space, reducing an epidural abscess. So abscess formation can lead to spinal cord injury, right? So it mainly occurs in osteomyelitis of the vertebral bodies. So these abscesses compresses the spinal cord and produces neurological problems. Clear? So all these comes in non-traumatic category. Next is neoplasm. So both benign and malignant tumors may compress the spinal cord, and it produces paralysis of rapid onset, right? So the malignant tumors compressing the spinal cord are secondary to their primary lesions in the breast, prostate, or bronchus, right? So the common benign tumors are spinal meningioma and neurofibroma. So spinal cord injury occurs in case of breast cancer, prostate cancer patients, and if the bronchus is involved, right? Next is demyelinating cause. So one of the commonest demyelinating diseases is producing neurological deficit and subacute combined degeneration, right? And it is mainly caused due to deficiency of vitamin B12, right? So because of this deficiency, vitamin B12 can lead to demyelinating condition, and degeneration of the spinal cord occurs and leads to spinal cord injury, right? Next common cause is infection. So one of the most commonest infections affecting the spinal cord is the tubercular infections of vertebral body. Right? If the patient is having tuberculosis in vertebral column, so that can lead to SCI. So tubercular infection may lead to paralysis of lower limbs, and it is known as POTS paraplegia. We have heard about POTS paraplegia, right? So if tuberculosis occurs at the vertebral column or in the vertebral body, right? So that can lead to POTS paraplegia, right? So this infection damages the spinal cord by the three factors. The first one is a cold abscess in epidural space. Next one is compression of the cord. And next one is compression of the vessels. Right? So all these are the causes of spinal cord injury, non-traumatic causes. Next one is some neurological diseases like MND, motor neuron disease, multiple sclerosis, neuropathies, and muscular dystrophies can affect the spinal cord, right? So all these factors comes in non-traumatic categories. So we have discussed traumatic factors and non-traumatic factors of SCI, causes of SCI. Now we discuss mechanism of injury. Basically, the spinal cord is injured by the two forces. One is direct forces and the other one is indirect forces. Now first we discuss direct forces injuries. So in this, the spinal cord may be directly injured without any serious injury to the spine by piercing wounds or by tiny pieces of missile which pass between the vertebral lamina. So the posterior columns are more severely damaged than the anterolateral columns. So in such type of injury, lesion in the spinal cord is limited to the level of the wound. So the nervous tissues present around that level are also contused or damaged. So this is the direct forces injuries. Next one is indirect forces or injuries. So indirect injuries are produced by abnormal movement of the spinal cord. The common example is whiplash injury. Right? What is this whiplash injury? Sudden flexion of neck followed by sudden extension of neck in road traffic accident. This is known as whiplash injury, right? Sudden flexion and sudden extension. So this can lead to spinal cord injury, right? So common mechanism causing indirect injury to the spinal cord are like flexion, compression, hyperextension, and hyperrotation, right? So these comes in indirect categories that leads to spinal cord injury. So these mechanisms typically occurs in combination and produce fracture, dislocation, and soft tissue damage. So it depends on the severity of forces, right? Magnitude of forces. So the intensity and combination of these mechanisms are directly related to the severity of the injury. So the different areas of the spine are susceptible to injury in different manner. Like some parts of the spine are severely damaged and some parts are less affected due to the greater stability. So the areas of the spine that are much prone to the injury are the area between C5 to C7, the most commonly affected area C5 to C7 in the cervical region, and the area between T12 to L2 in the thoracolumbar region, right? So these areas are more prone to the injuries, right? Because the mobility is there. So area between C5 to C7, so in cervical region, and the area between T12 to L2, or we can say T12 to L2 in thoracolumbar region. So these are more prone area to the injury, right? Now we discuss mechanism like flexion injury. It is the commonest mechanism of injury to the spinal cord, occurring during sudden flexion of head, as in head-on collision of vehicle or in road traffic accidents, or blow to the head or trunk on the back side. So the commonest site involved for injury is lower cervical region, that is from C2 to C7, and lower thoracic, that is T12 to L2. So this injury causes wedge fracture of the anterior vertebral bodies, right? Wedge compression or wedge fracture of the anterior vertebral bodies, and rupture of posterior longitudinal ligaments, right? So ligament rupture causes anterior dislocation of vertebral bodies. So basically vertebral column is supported by the so many ligaments, anterior longitudinal ligaments, posterior longitudinal ligaments, intervertebral ligaments, right? So all these ligaments supports the vertebral column. So because of ligament rupture, the vertebral body dislocates. It can lead to spinal cord injury. Clear? So flexion injury is very common. And the other type of injury is that is compression injury. And this injury is mainly caused due to falling off some heavy object over the head, right? Or due to vertical blow overhead on diving. So somebody dives in a shallow water, compression injury can occur. So compression injury leads to burst fracture of the vertebral body, right? So burst fracture may lead to neurological involvement as tiny bony fragments lodge into the spinal cord. These tiny pieces of vertebral body can damage the spinal cord, right? Neurological problems can appear. This is compression injury. This injury mainly caused due to the falling of some heavy objects on the head or diving in a shallow water, right? Next mechanism is hyperextension injury. Hyperextension. The neck goes in the hyperextension, or the vertebra goes, or vertebral column goes in hyperextension. So it is caused due to sudden extension of head, as in rear end collision of the vehicle. In road traffic accidents, we can see such type of condition. Like in elderly population, the main cause of this type of injury is fall, right? So with chin hitting over some stationary object, hitting of the chin leads to sudden extension of head. So when any object, stationary objects, strikes the chin, so head goes in hyperextension. The hyperextension injury generally leads to fracture of C1 and C2 and the odontoid process, right? So this is a very fatal condition. So there occurs posterior dislocation of vertebra due to rupture of anterior longitudinal ligament, right? Anterior longitudinal ligament. It supports the column anteriorly. Here. Next mechanism is flexion with rotation injury. It also leads to spinal cord injury. It caused due to sudden twisting force, right? And this injury causes rupture of posterior and interspinous ligaments, which leads to unilateral facet dislocation with mild displacement of vertebral body. So severe injury causes dislocation of C5 with destruction of the spinal cord, right? So whiplash injury, flexion injury, extension injury, compression injury, hyperextension injury, and flexion with rotation injuries. All these can lead to spinal cord injuries, right? Now we discuss classification of cord injury. So everyone is getting my point, no?
Yes, sir.
Right. Now we discuss classification of cord injury. So on the basis of severity of the injury and damage the injury has caused to the cord, the SCI can be classified in two categories. One is complete spinal cord injury, right? One is complete, and the other one is incomplete spinal cord injury. Clear? So this classification is based on severity of injury and damage of the spinal cord. So depending on the site of lesion, the complete SCI can further categorized as quadriplegia and paraplegia. All these are very important points. So depending on the site of lesion, right? Lesion can occur at the cervical region, lesion may occur at the thoracic region, lesion may occur at the lumbar region. So it depends on the site of lesion, the complete SCI can be categorized as quadriplegia and paraplegia. So both complete and incomplete SCI can easily be distinguished from each other by assessing the normal functions of the nerves and the muscles, right? If there is some power, if, you know, so that comes in category of incomplete type of spinal cord injury. And if there is completely loss of muscle power, that comes in complete spinal cord injury, right? So if the muscle power is graded as 3 plus below the level of lesion and sensations are fair, then it is classified under the incomplete type of spinal cord injury, right? But at the same time, if motor and sensory both functions are completely impaired below the level of lesion, then it is classified as complete spinal cord injury. Means if there is motor and sensory loss below the level of lesion, complete loss of motor function and complete loss of sensation below the level of lesion, right? It comes in the category of complete SCI. One type is incomplete SCI, and the another category is complete SCI. So complete SCI and incomplete SCI. For example, if lesion is at the level of L1 and both sensory and motor functions are zero below the level of lesion, then it is termed as complete paraplegia, right? Paraplegia means paralysis of both lower limbs with involvement of some part of the trunk. That is paraplegia, right? Complete loss of motor function and sensory functions, right? That is called as paraplegia. But if there is at least fair sensation and fair motor control, then it will be termed as incomplete paraplegia. If the patient is having some power in the muscles below the level of lesion, that comes in incomplete paraplegia. And if there is complete loss of motor function and sensation, that comes in complete paraplegia, right? Clear? So by this we can distinguish the complete paraplegia or incomplete paraplegia. Right? So now we discuss complete SCI first. So complete injury to the spinal cord is caused by complete transaction and severe compression or by total cut of blood supply to the cord. Right? If there is complete transaction, means complete cut, severe compression, and the total cut of blood supply to the spinal cord. Right? So in incomplete SCI, several segments of the spinal cord are destructed. So due to this, gray matter present in these segments and tracts passing from these segments are badly affected. Right? So in case of complete SCI, sensory and motor functions are totally impaired. This is an important point. In case of complete SCI, sensory and motor functions are totally impaired below the level of lesion. Below the level of lesion. So complete SCI leads to quadriplegia if the lesion occurs at the higher level, especially in the cervical lesion, and the paraplegia in the lower level of lesion, means lumbosacral lesion. Right? So what is quadriplegia? What is paraplegia? Anyone knows? Quadriplegia, paraplegia? What is quadriplegia? Anyone?
So
Pragati,
complete
Manika, yes?
paralysis.
Yes,
So
Nancy?
complete paralysis in all four limbs. That condition is called as quadriplegia.
Yes.
And when there is a complete paralysis or partial paralysis in a trunk and the lower legs, lower extremities, that condition will be termed as a paraplegia.
Right, right. So if all the four limbs are involved, there is complete paralysis of all the four limbs with involvement of trunk. That is known as quadriplegia. Right? And paralysis of both lower limbs with the partial involvement of trunk. That is known as paraplegia. Right? There are two more terms. One is quadriparalysis and paraparalysis. So that will come in incomplete type of spinal cord injury. Right? Means weakness in the all the four limbs and the trunk, that will come in quadriparalysis. And the weakness in both the lower limbs with some part of the trunk involvement, that will come in paraparalysis. Right? Depends on condition. Depends on injury. Right? So quadriplegia and paraplegia, it comes in complete type of spinal cord injury. Quadriplegia refers to complete paralysis of all the four limbs and trunk, including respiratory muscles. Right? So quadriplegia results due to cervical cord injury. If the injury occurs at the cervical region, right, it leads to quadriplegia. And paraplegia, it refers to partial or complete paralysis of a part of a trunk or whole trunk, and both the lower extremities is known as paraplegia. The paraplegia results due to thoracic or lumbar cord lesions. Right? So if lesion occurs at the level of cervical lesion, that leads to quadriplegia. The lesion occurs at the lumbar lesion, right, or thoracic lesion that leads to paraplegia. Clear? Now we discuss incomplete SCI. Incomplete injury to the spinal cord is generally caused by any swelling within the spinal canal, any protrusion, any disease affecting a particular site, partial transaction, not complete, partial transaction, and contusion of a spinal cord due to the displaced bony or soft tissue structure. Clear? All these comes in incomplete type of spinal cord injury. So in incomplete type of spinal cord injury, all the neural structures or tissues are not damaged at the site of lesion. So some neural tissues remains intact and are capable of conducting impulses. That's why it is incomplete type of spinal cord injury. So these neural tissues help to preserve some sensory or motor functions below the level of injury. Right? So incomplete SCI results into different syndromes on the basis of the part of the spinal cord affected. And these syndromes are anterior cord syndrome, posterior cord syndrome, central cord syndrome, Brown Sequard syndrome, and Cauda equina syndrome. Right? So anterior cord, posterior cord syndrome, central cord syndrome, Brown Sequard syndrome, and Cauda equina type syndrome. All these comes in incomplete type of SCI. Right? There is partial damage of SCI. So first we discuss anterior cord syndrome. Right? So anterior cord syndrome is caused due to flexion injury of the cervical spine. Right? So it leads to damage of anterior portion of the cord. Flexion injury, right, like this, flexion injury, the anterior part of the cord will be involved. So it leads to damage of anterior portion of the cord and compression of anterior spinal artery. So due to ischemia or compression, damage of corticospinal and spinothalamic tracts takes place, and this results in loss of motor function and loss of sense of pain and temperature below the level of lesion. Right? So in this, anterior part of the cord will be damaged, and this results in loss of motor function and loss of sense of pain and temperature below the level of lesion. Right? यहाँ पर इंजुरी हुई है उसके नीचे, below the level of lesion. So this is anterior cord syndrome. Right? The other one is central cord syndrome, in which The central part of the spinal cord is affected. That's why it is central cord syndrome. So central cord syndrome results due to hyperextension injury of the cervical lesion. So the central part of the cord is damaged by hemorrhage or edema produced from compression of the cord. So due to central compression, there is neurological involvement in the arms as the cervical tracts supplying the arms are centrally placed. So the lower limbs are less affected as the lumbar and the sacral tracts are present at the periphery, right? So thus it leads to classical flaccid paralysis of arms and spastic leg functions, right? So if the central cord is involved, there will be flaccid paralysis of the arms and the spastic leg functions we can see. Next one is sacral sensations and blood and bowel functions are often preserved because the central cord is involved. So sacral sensations and blood and bowel functions will be preserved. So this is central cord syndrome because in this the central part of the spinal cord is involved, right? Next one is the posterior cord syndrome. In the posterior cord syndrome, the posterior part of the spinal cord will be involved. But the spinal cord syndrome is a rare syndrome, most often seen in hyperextension injuries with the fracture of the posterior part of the vertebra, right? So as there occurs contusion of posterior column, so there is loss of proprioception, 2-point discrimination, rhapesthesia, and stereognosis below the level of lesion, right? And sometimes there is profound ataxia, which makes walking difficult, right? Ataxia means uncontrolled movement, ataxia. So when the posterior part is involved, there will be loss of proprioception, rhapesthesia, 2-point discrimination, and loss of stereognosis, right? But this is a rare condition. So
सर
this is
सर
posterior cord syndrome.
सर
Yes,
एक लाइन लिखी है सर, कंट्यूजन ऑफ पोस्टीरियर कॉलम, इसका मींस?
yes. Contusion. Contusion means injury to the particular area. One condition is concussion. One thing is contusion, and one is laceration. Right? There are 3 categories. One is concussion, contusion, and laceration. So mild type of injury is concussion, right? Moderate type injury is contusion. The severe type is laceration, right? So contusion is moderate type of injury to the particular area or the nerves or the spinal cord. That is contusion.
Okay, sir.
right? So this is all about anterior cord syndrome, posterior cord syndrome, and central cord syndrome. Now we discuss Brown Sequard syndrome. So in this, half section of the spinal cord will be involved. So Brown Sequard syndrome classically results from piercing injuries and occurs from hemisection of the spinal cord. Right? Hemisection means half section. So in this syndrome, power is reduced or absent on the same side of injury, but pain and temperature sensations are relatively normal on that side, whereas on the contralateral side opposite to the side of injury, power is normal, but sensations are lost. This is due to damage of spinothalamic tract on the injured side. So these are the features of Brown-Sequard syndrome. So in this, power is reduced on the same side of injury, right? But pain and temperature sensations are relatively normal on the same side. On the contralateral side, power is normal, but the sensations are lost. This is Brown-Sequard syndrome, right? Now we discuss cauda equina syndrome. So in cauda equina syndrome occurs due to complete or incomplete transaction at cauda equina. So cauda equina is a collection of long nerve roots below the termination point of spinal cord. So where the spinal cord terminates? Anyone?
Sir, lumbar second.
Which level?
Say L2 level.
L2 level, yes. So spinal cord terminates at the L2 level. And below this L2 level, there is a bunch of nerves, right? That is known as cauda equina, right? Cauda means tail, and equina is related with equinus. So it will look like a horse tail, right? So that's why it is a cauda equina. So cauda equina lesions are usually incomplete because of large number of nerve roots and large space they occupy, right? So all these comes in incomplete type of spinal cord injuries: anterior cord syndrome, posterior cord syndrome, Brown-Sequard syndrome, central cord syndrome, and cauda equina syndrome, right? So if in examination the question comes, explain the incomplete type of spinal cord injuries, so you have to explain all these syndromes. Clear? This is all for today, right? Any questions if you want to ask? Anything related to this topic, you can ask. In next class, we will discuss pathology, clinical features, management of spinal cord injury patients. अभी कुछ डाउट है आप लोग पूछ सकते हैं. Pragati, Manikant, everyone is present, no? Pragati, Manikant, Nishu, Nancy, Imam, Satyam, Anupma. Okay, in next class we will discuss the rest of the things, right? So take care.
Thank you, sir.